Welcome to Equal Ground Headlines, bringing you your balanced coverage on trending top stories in Canada. I am Samuel B. Williams. Clear news deserves a clear signal. Hit like, hit subscribe, and stay grounded. In Geneva, a landmark global accord to prevent the next pandemic has been reached. But the absence of the United States is casting a long shadow over the celebration. At the World Health Assembly this week, member states of the World Health Organization, who formally adopted a pandemic preparedness treaty, a legally binding agreement aimed at ensuring a more coordinated, swift response to future global health emergencies. As delegates applauded the pact's passage after 3 years of negotiations, one chair at the table remained notably empty. The United States of America. The new agreement, hailed by WHO Director General Dr. Tedros Adhanom Ghebreyesus as a breakthrough that will better protect the world in the next crisis, attempts to fix the glaring problems exposed by COVID-19. It calls for improved international surveillance of emerging pathogens, commitments to share vaccines and treatments more equitably, and clear protocols for declaring and responding to a public health emergency. In essence, it's meant to prevent the disjointed response and global disarray that characterized the early COVID days. No one country can tackle a pandemic alone, as we all learned at such cost, Dr. Tedros said, praising the unity of the 194 nations that backed the deal. However, the unity was not complete. The United States, under President Trump, has refused to participate in the treaty effort. In fact, the U.S. has taken steps to withdraw from the WHO altogether, a process set to finalize in 2026. American officials have been no-shows in the pandemic accord talks for months, objecting to provisions they claim impinge on U.S. sovereignty and to the very idea of binding international health rules. Washington's stance has drawn both anger and sorrow from allies. It's obviously better if the U.S. is on board. A pandemic by definition affects everyone, said one European diplomat. Their absence here is deeply regrettable. The German health minister was more blunt. A chain is only as strong as its weakest link. Right now, the international health chain has a missing link, and that is the U.S. Despite U.S. opposition, the remaining nations pressed ahead. The treaty's adoption was met with a standing ovation in the Assembly Hall. Delegates from around the globe described it as a triumph of multilateralism. Key points of the agreement include a commitment by all signatories to share virus samples and genome data instantly during outbreaks, a mechanism to allocate vaccines and medicines to poorer countries before wealthy nations hoard supplies, and funding provisions to strengthen health systems in vulnerable countries. There are also measures to combat misinformation and to ensure any travel restrictions or lockdowns during a future pandemic are science-based and as coordinated as possible. Yet, many acknowledge that without the world's largest economy and a historic leader in global health on board, the treaty's bite might be weaker. The accord can't force any country to produce or export supplies. For instance, it relies on goodwill and pressure. If a new pandemic struck, the hope is peer pressure, and the framework of this pact would compel cooperation. But skeptics wonder, if the political winds blow nationalistic, would countries truly honor these pledges? The treaty tries to account for that by being legally binding. In theory, signatories could face diplomatic or economic consequences for breaking the rules. In practice, enforcement in international law is notoriously tricky. It's worth noting that even some present signatories harbor reservations. A handful of countries, notably Brazil and India, had pushed to soften certain language around intellectual property sharing, fearing it might undermine their pharmaceutical industry. Those debates were intense, but ultimately resolved, with the final text urging voluntary licensing of critical drugs during emergencies and contemplating compulsory measures only as a last resort. In the end, consensus carried the day in Geneva, minus the U.S. delegation. Why is the U.S. out? The Trump administration has argued the WHO mishandled COVID-19, echoing complaints from his first term and accusing the organization of being too deferential to China in the pandemic's early stage. Trump pulled U.S. funding from WHO shortly after regaining office and recommitted to the withdrawal initiated back in 2020. U.S. officials say they are pursuing their own bilateral and multilateral preparedness efforts and don't need to be part of what they view as a globalist treaty. Domestically, Trump's allies praise the move as standing up for American autonomy. But global health experts worry that without U.S. expertise and resources, the treaty's effectiveness could be limited. It's like the fire department is missing one of its largest fire trucks, said an analyst at the Global Health Council. Nevertheless, members are pressing forward. We cannot wait for everyone to agree. We have to move ahead with those who are willing, said a representative from Kenya, drawing applause. Already, implementation plans are underway. Regional pandemic hubs will be established to ensure rapid deployment of medical teams. Stockpiles of protective equipment and testing kits will be maintained under WHO coordination. An international pandemic radar system, using satellite data, social media trends, and AI to spot outbreaks, is in development. Interestingly, many of these efforts involve American scientists and institutions, even if the U.S. government isn't formally part of the treaty. Workarounds, it seems, will be the norm. In a poignant moment at the Assembly, Dr. Maria van Kerkhove, a top WHO epidemiologist, spoke of colleagues lost to COVID-19 and urged the world not to waste the painful lessons learned. The whole observed a minute of silence in memory of the pandemic's victims. Afterward, delegates resolved to have the treaty ratified within their own countries as needed and put into action immediately. The world has come together, with one notable exception, to say, "Never again," Dr. Tedros said. Never again should we be so unprepared, so uncoordinated in the face of a common threat. The true test of that vow will come when the next novel virus emerges, whether next year or a decade from now. Will nations share data instantly? Will vaccines be allocated by need rather than wealth? The pandemic treaty is a bold attempt to say, yes, they will. For now, the global community has a framework and newfound hope that next time, things might be different. But that hope comes with an asterisk. As long as one major player stays on the sidelines,